Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thank you for joining me tonight. Tonight's topic is near and dear to my heart because I really hope that every single patient of mine graduates. I want everyone to eventually see their OBGYN because they're successful after their IVF cycle. But this is the thing, as soon as you get word that your cycle is successful, you might be jumping up for joy, or you might not be feeling as excited as other people might want you to be feeling, and that's totally okay. You're not alone. And so pregnancy is just not one of those things that everyone enjoys. Not everyone feels sexy and radiant. A lot of times it can be really depressing, especially after an IVF journey, because pregnancy actually isn't as enjoyable as you may have thought it would be. Maybe you're feeling sick all the time, you're really tired, maybe you're still having some symptoms of PTSD. So it's so important to talk to a fertility therapist, someone who really knows what you've been through, and someone who can guide you as far as what you can do to improve your mind-body health going through pregnancy. Because the thing is this, when you're going through fertility treatment, you're being seen all the time. Lots of checkups, lots of blood draws, lots of ultrasounds, and all of a sudden you're now pregnant, and now you feel like you have all this time on your hands because you're not seeing your doctor, and you start going to Google for sources or answers to your questions. So what I ask patients to do is think of me as luggage. I used to say think of me as herpes, but then people would look at me like I was weird or kind of a little nutty. But this is the thing, I'm always there for you. And you want to find an OBGYN who will be there to answer your questions. So be sure whenever you have a question, don't just rely on Google, talk to your doctor, get all the support you need, read articles from trusted sources, and like I just said, talk to a mental health professional. So you already know, because I just told you that after an IVF cycle, you're not going to be seen as often. So going through IVF, you're seen maybe 6 times from start to finish, and now as soon as you're pregnant, you're seen maybe once a month. So all of a sudden, the anxiety and paranoia can take over, especially in the beginning, in the first trimester, where you're not feeling anything. You might be worried because you're not feeling nauseous, or you're feeling like your breasts were tender and now they're not so tender, or you're not feeling as tired as you were the other day. So these thoughts can all just be so overwhelming, and you should know that these feelings are very, very normal. So find a support group, maybe a support group through Resolve, of other people who've been through fertility treatment who are now pregnant. And you guys can all be, pregnancy buddies, so to speak. And I never take a minute of pregnancy for granted, but I certainly celebrate every milestone with my patients. So when I get a positive pregnancy test with a patient of mine, I always congratulate them on reaching that milestone. But I know that part of the human condition is having an abnormal pregnancy for some people, or having a miscarriage. And so certainly I don't want to make it seem like I don't realize that those things happen, but at the same time, the way I think about it is life's too short not to celebrate every single joyous moment that life can bring us. So when you get your first pregnancy test, ask your doctor, what's the level of pregnancy called HCG hormone in my blood that you expect at this stage? So I check HCG levels 8 days post 5-day transfer or blastocyst transfer. And typically, I expect a level to be over 15. And the lowest HCG level that I've seen in a family to have a healthy pregnancy is 13. I've seen that before. And I've seen all sorts of things where levels don't rise, they actually go down. And for me, a pregnancy is not over until it's over. And over means the level really just isn't rising, or it's truly going down. Because 15% of normal pregnancies do not have that regular rate of rise that you would expect. And an ultrasound can also be used to confirm whether the pregnancy is healthy or not about 2.5 weeks after that first pregnancy test. So that's when you're about 6.5 weeks pregnant or so is where we see the heartbeat. So that can be a very nerve-wracking day because you're so nervous. And if you're nervous in between your last pregnancy test and that ultrasound, well, there's a simple fix. For my patients, what we do is we check more levels. So if level checking decreases your level of anxiety, well, that's a very simple thing to do. In between your first HCG level and second HCG level in your ultrasound, you can do maybe another blood test every 5 days or so until your ultrasound. So when it comes time to transferring to your OBGYN, it may not be a bad idea to actually do research in your area of OBGYNs that you may want to see before you actually go see them. Paul, what's that name of that movie where she interviewed all those OBGYNs? I forget. It was hilarious. Paul is my producer. And so I forget the name of that movie, but there was a movie with a famous actress, and there was one scene there's a couple scenes that I'll never forget. And you can sort of do that. You can kind of date different OBGYNs until you figure out the right match for you. Someone who's really going to be there for you, listen to your concerns, and talk you through what all the steps are. It doesn't have to be them. It could be their healthcare extender like nurse practitioner or midwife. So once you get to the OBGYN when you're over 9 weeks pregnant, there's still more tests that are going to be done. So for example, you can do an NIPT, which is a test that detects cell-free DNA in your blood. You can do a single gene disorder test, and you can also do something called the quad screen. I don't expect for you to just listen to me rattle off these tests and think that this is the complete list. It certainly isn't, but these are just some big picture items that you might be asked to do. So talk to your OBGYN about them and ask, are these tests for me? And then once you're in the second trimester, we're going to learn more about your baby's health. They're going to do a test called the AFP blood test that tells us if the baby has a neural tube defect, like a condition called spina bifida. The other thing, and this is a blood test, I think a lot of people are scared that somehow there are going to be tests that are done that might be invasive and harm the baby. And the other thing that we do is an anatomy scan. So an anatomy scan looks basically at not basically, but at the fingers and toes, looks at the ventricles of the heart, the ventricles in the brain, and makes sure that the baby gets a clean bill of health. And sometimes you might find something that makes you think that it might be not a bad idea to consider an invasive procedure called an amniocentesis, so that you do learn everything there is to learn about your baby in the second trimester. We also look at weight, blood glucose level, urine, protein and glucose levels, blood pressure, and then urine, blood, and glucose levels, just to make sure that everything's on track and you're not developing a condition called preeclampsia. So again, Google is great, but you want to make sure that you rely on your doctor's answers. And if your gut's saying something like, something's just not right, well, be sure to speak up for yourself. And if you're a patient of mine, you can reach back out to me and I can help guide you about where you are in pregnancy. And there are also 2 other trimesters, the 3rd and the 4th. So the 3rd trimester is when everyone's asking you, do you have the crib ready yet? Do you have the stroller yet? Is your baby room ready? So what I tell people is, just say yes, and remember all you need is a boob, a onesie, and a diaper. So that's all you need, and a lot of love. And then when it comes to the 4th trimester, that's postpartum period, and that's where we really want to make sure that your mental health is well taken care of. And if you're feeling depressed, it's not uncommon, especially after a fertility journey, make sure you're talking to your OBGYN, talking to a therapist so that you can get the help that you need as you transition from the 3rd to the 4th trimester, which is the postpartum period. So I know all too well the ups and downs of pregnancy because I go through these things with my patients. And so I hope that just learning that you're not alone if you're feeling anxious after a fertility journey in pregnancy, I hope that will help you. And reach out to me through eggwhisperer.com and I'm happy to help you more. Have a great night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Bazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.